My name is Graham Norton, and in this video I'm going to discuss skill issues versus capacity issues in the weight room in relation to the barbell back squat and the Romanian deadlift. When looking at skills and capacities in the weight room, a capacity issue usually presents itself as a mobility or lack of range of motion issue or a lack of strength, and a skill issue is more related to the athlete's motor control or their awareness of their own body in relation to the movement itself. When looking at our first athlete performing his squat assessment, we can see that from the side view, it's not a terrible looking squat. However, he does struggle to achieve the appropriate depth. And also when we look up from the front, we can see there's quite a noticeable amount of knee valgus, as well as a slight hip shift to his left-hand side. We started by looking at his ankle mobility by using knee to wall test. This would tell us not only the range of motion in his ankles, but also if there was any differences from side to side. Next, because of the athlete's knee valgus during the squat pattern, we looked at his hip external rotation in this supine position to look at his range of motion passively at the joint. Next, we assessed his active straight leg raise, which is a test not only for the hamstrings but for the posterior chain to see if there was any restrictions there in that movement as well. During the athlete's knee to wall test, we noticed there was quite a significant difference in the range of motion between the right and left ankles. So we prescribed this banded ankle mobility drill to try and improve that range of motion in the hope of helping to improve his squat pattern. We also noticed there was quite a significant difference in the hip external rotation and side to side as well. As you can see, by how much the athlete struggles to get into this hip external rotation restrictions shown, I would conclude that the athlete had more of a capacity issue than a skill issue, and while we are working on these capacity issues, we give him a movement regression of a box squat in the meantime until they improve. Next, we'll look at athlete B's squat assessment, and from this side angle we can see that she does struggle to achieve an appropriate depth, and also she has quite a noticeable anterior pelvic tilt, as well as struggling to keep the chest up in that bottom position of the movement. When we look at the front view, there's no noticeable knee valgus, but again we can see the lack of depth and also the slight lean forward as she goes into the bottom of the movement. Next, we assessed athlete B's range of motion in the same way as we did with athlete A, and this is to rule out whether it is a capacity issue we are seeing in her squat. So we looked at her knee to wall test, and this showed that she was symmetrical on both sides. We then looked at her hip external rotation test, which showed impressive levels of mobility on both sides, again being symmetrical. And we also looked at her active straight leg raise with, again, no difference side to side and a good range of motion throughout the pattern. So for these reasons, this would imply that it was less of a capacity issue we are seeing in the athlete, and we would have to look at a test to try and see whether it was more of a skill issue we are seeing. So next we need to look at a test that can tell us whether it is a skill issue that we are seeing. So we use a counterweight squat to give the athlete some false stability, which will help to make the movement easier. And as you can see from this here, how much nicer this squat pattern looks with the counterweight squat. To try and help improve the movement, we got the athlete to perform some wall-supported posterior pelvic tilts to try and reduce some of that anterior pelvic tilt we see in the movement and teach the athlete the proper pelvic positioning during the squat. A movement we use with the athlete as a regression is a goblet squat, as within this position with the weight, it is easier to get into a posterior pelvic tilt of the pelvis, and also the weight being in front of the body helps the athlete to sit back into the hips and achieve a better depth. Alternatively, if we wanted to keep an athlete on the barbell, what we could do is raise the heels, even though the athlete didn't show any issues with ankle mobility. What this also helps to do is help the athlete to perform the movement with more of a posterior shift and achieve greater depth. The next athlete we will look at is athlete C, who is performing a Romanian deadlift here with the barbell. And as you can see, as they descend into the movement, they have quite a noticeable amount of lumbar flexion as they get just below the knee. To help determine whether this is a skill or capacity issue, we get the athlete to perform both a standing toe touch test and a lying active straight leg raise. And as you can see from both tests, the athlete does struggle with these movements and shows a lot of tightness around the posterior chain, specifically the hamstrings, and also the athlete when standing has a noticeable amount of anterior pelvic tilt. Because this anterior pelvic tilt can pull the athlete into extension and reduce the range of motion in terms of the Romanian deadlift, we want to perform drills that allow the athlete to practice being in less extension at the lumbar spine, and this 90-90 breathing drill is really good for that. Then, to try and improve hamstring range of motion, we get the athlete to perform some rack supported leg lowers. So these again are good for improving mobility around the hamstring, and also we are going to be tying in the breathing into this as well to try and get the athlete to really pull the rib cage down as he's lowering the leg and stretching the hamstring. Also then, because of the excessive anterior pelvic tilt, we are getting the athlete to perform a bird dog by getting himself into a neutral spinal position and then extending the arm and leg, trying to focus on keeping that spine as stable as possible as he is moving the limbs. As this was more of a capacity issue, this may take a while to improve the range of motion in the athlete, so we can get him to perform a reduced range RDL and only get the athlete to go to just above the knee so that he's not going into as much flexion during the movement. Here we can see athlete D performing a Romanian deadlift, and he also has quite a noticeable amount of lumbar flexion as he descends into the bottom of the movement. This again needs to be assessed in the same way we did with athlete C. So we get the athlete to perform both a standing toe touch and also to perform an active straight leg raise. And as you can see with this athlete, he doesn't seem to show any restrictions around the posterior chain or hamstrings in both these movements. So this would lead us to believe that it is less of a capacity issue and more of a skill or motor control issue that we're seeing in the pattern. Because of this, we focus on teaching the athlete the skill of the hip hinge in the hope of improving his Romanian deadlift. So as you can see here, the athlete is struggling to perform a hip hinge with a dowel, but after a bit of coaching, we can try to get the athlete into more of a neutral spinal position as he hinges back, which is much improved here, keeping the head, shoulders and lumbar in line with the stick as he descends back into the movement. If we wanted to add load to that pattern before going back to the RDL, we can get him to again perform a hip hinge, which is called a kettlebell good morning, with the kettlebell being the load. So the athlete is still practicing that technique, but we're adding a little bit of load to that. And again, as a movement regression before going back to the RDL, we can get the athlete to perform a glute bridge to again strengthen the same or similar muscles as the RDL while not performing the movement itself yet. But when we get the athlete to perform the RDL after going back and teaching him a proper hip hinge pattern with a dowel, we can see that there isn't any noticeable amount of lumbar flexion in the bottom of the movement.